Leader of the third party.
Thank you, Honourable Speaker. Yesterday, the White House released a memo on addressing the effects of long COVID, recognizing that anyone who has had a COVID infection can experience long-term and chronic effects from this virus. The United States is creating a federal long COVID program. In this province, there are potentially 83,000 BC residents experiencing symptoms of long COVID. For them, the pandemic is far from over. Long COVID can be severe. A recent peer-reviewed study found that long COVID can cause a spectrum of symptoms, including systemic, neuropsychiatric, respiratory, cardiac, gastrointestinal, and endocrine complications. Long COVID has been shown to occur after both mild and severe cases of COVID, and while some preliminary literature suggests that vaccinations reduce the incidence of some symptoms, vaccinations have not eliminated the risk of long COVID. Our understanding is still evolving, and all governments have a responsibility to recognize the people who are and will struggle with the effects of long COVID. My question through you, Honourable Speaker, is to the Minister of Health. What responsibility does government have to inform, educate, and support the public when it comes to long COVID?
Minister of Health.
Honourable Speaker, the first thing I'd say in response to that question should be obvious to anyone who's reviewed the COVID-19 pandemic anywhere, is the best way to avoid COVID, the best way to avoid serious symptoms of COVID, the best way to avoid long COVID, the best way to survive COVID is to get vaccinated, and get vaccinated when you're invited to do so. That is the best way, Honourable Speaker. With respect to long COVID, it is an absolute priority. We know that many people recover differently and do not recover well and have long-term results and consequences of COVID-19. It's all the more reason why it's important to be vaccinated. It's why we set up the Interdisciplinary Clinical Care Network, which is the first of its kind in Canada, to coordinate our response across health authorities to make sure that people get the care they need. Our post-COVID recovery clinics are in place, and they don't just support direct patients at the clinics in the thousands with positive results, but they support primary care providers and healthcare providers across BC because we've taken those steps. There is more to learn and there is more to do, and BC is leading Canada in that regard and working with everyone in the world to support people who are struggling with COVID-19.
Leader of the third party, supplemental.
Thank you, Honourable Speaker. Indeed, there is still much more to learn. And vaccinations absolutely reduce the risk, according to the literature. However, we know that transmission of COVID is happening, even amongst people who are vaccinated, and that long COVID remains a risk. Dr. Zach Swartz is the lead of the post-COVID recovery clinic at Vancouver General Hospital. He recently stated in an interview with CTV that even with clinical support, some patients, quote, seem to have stalled and not recovered. And those patients in that clinic are the lucky few to have made it up to the top of the waiting list. Honourable Speaker, people are grappling with a new illness that has impacted their day-to-day lives. Some have lost their livelihoods. They have little information and limited support. Through you, Honourable Speaker, to the Minister of Health, beyond the COVID post-recovery clinics, which can't serve everybody who in this province is suffering from long COVID, what additional supports can the tens of thousands of British Columbians managing long COVID expect from this government?
Minister of Health.
Thank you, Honourable Speaker. Well, first of all, with respect to information, because the member talks about information, patients and their caregivers can access, Honourable Speaker, can access the interdisciplinary clinical care networks, online education tools and resources to support themselves as they recover. We have put in place, the first in Canada, a comprehensive system that supports people across British Columbia. We have long COVID clinics for people, and anyone who has symptoms beyond 3 months can ask to become involved and get support through those processes. Those are in place now. We need to have, and it's why it's so important to have a robust primary care network across BC to support people who are dealing with chronic illnesses across the spectrum, from continuing to suffer the effects of COVID-19 to other chronic diseases such as diabetes, and we have to continue to build that. But I would say this, Honourable Speaker, I can't emphasize it enough, that it is important now to get vaccinated. There are 68,000 people over 70 who've been invited to get their booster dose who haven't got it. They need to phone up today. There are more than 450 pharmacies available to give vaccinations today. Last week, there are more than 100,000 unfilled appointments. We can support each other and prevent this as well by getting vaccinated.